Hi everyone, so today we're going to be talking about concussions. And what exactly is a concussion? A concussion is basically when the brain slams into the side of the skull. So let's take a look at this real quick. Well, first let's write it down. So concussions is when the brain slams into the skull. Okay? So being that we're on this, so what can happen in concussions? Well, first of all, what can happen in concussions, because the brain is slamming into the skull, what can happen is you can get bruises. All right? And so not only can you get bruising, but what can happen sometimes is you can break the blood vessels that are actually inside of the brain. So you get bruising, you can get broken blood vessels. All right? Which this is bad because of the fact that if we have broken blood vessels, which is basically what a bruise is, what's going to happen is if we're not careful, if that leaks too much, you can actually end up with a stroke or some type of severe damage. So you get the broken blood vessels, and then of course, because the brain is completely made of nerves, what happens is you can also get some nerve damage. Okay, so you can also get some nerve damage there. Normally after a concussion, what's going to happen is there may be some visual disturbances. All right, disturbances. And so sometimes like they may get double vision or something like that, okay? There could also be cognitive problems. So it's not uncommon, and I'll talk about this in a little bit later too, that after you have a blow to the head and a concussion, normally what we'll do is we'll ask people about if they know what day it is, do they know their birthday, do they know where they're at, to kind of get an idea for how bad the concussion might be or how bad the blow might be. Okay, and also there could be a loss of consciousness on this also. So let's go ahead and take a look at this some more. And to give you an idea of what happens, I am going to draw the head. Okay, I'm going to basically draw the brain. So here's my brain. There's the central sulcus. All right, so there's my brain. Off of here, I have the cerebellum, I have my brain stem. There's my brain. So now, surrounding the brain, you have three protective layers, which are called meninges. So let's take a look at our meninges. The inner layer of the meninges is called the pia mater. Okay, so there's my pia mater. And then you have a middle layer of meninges, which is called the arachnoid. And then you have a thicker outer layer of meninges, which is called the dura mater. The pia mater stands for delicate mother because it's the thinnest inner layer. The arachnoid stands for spidery. All right, and then the dura mater is the thick outer layer, and this stands for tough mother. So like I said, that's on the outer layer. If you notice here, what you'll notice between these two pieces of the dura mater is there's a space in there, and that space contains a fluid which we call cerebrospinal fluid. We call it CSF for short. Now, here's the thing is these meninges are designed to protect the brain, and they're also around the spinal cord, so they're designed to protect the spinal cord also. As you notice, there's a fluid in there. So what some people say is that the brain actually sits in a fluid. It's a very thin layer of fluid, but there is a fluid that surrounds the brain and the spinal cord also. So we have protection of the brain due to the meninges, the three layers of the meninges, and the cerebrospinal fluid. So on the outside now, we have, let me go with orange here. We're going to have our skull. This is going to be the skull that's out here. I'm leaving a little bit of space here simply because, actually I'll color it in. Okay, so this is my skull right here. All right, that's the skull. So what's going to happen in a concussion, as you can see, everything's in there pretty tight. So what happens is, let's say you're playing football and you go head to head with somebody. The brain will actually shift and hit against here. And because you have blood vessels and nerves all in here, these may actually break open and you'll start to get some bleed into the blood vessels in there. Okay, so that's basically how my concussions can occur. Let's talk about the different types of concussions. Okay, and so the first type is just a mild concussion. We call this a grade 1. And in a grade 1 concussion, my symptoms are going to last for less than 15 minutes. So symptoms last less than 15 minutes. So let's say you have a football player. Symptoms last less than 15 minutes. Okay? So let's say you have a football player and he's playing and he gets hit real bad. He's down. You pick him up, you carry him off the field, and what they'll start doing, what the people will start doing is they'll start asking him questions. They'll start testing the cognitive ability. And again, it's asking like what his name is, when's his birthday, does he know where he's at? If there's no problem there, usually you can send the person back in. If there's a problem, but after 15 minutes they can answer those questions, then they basically had a mild concussion. They still would probably lose some playing time from this. Okay. Also with this, there's no loss of consciousness. LOC stands for loss of consciousness. They're not knocked out. Okay. That's the first type. The second type is a moderate concussion. In a moderate concussion now, this is a grade 2. Actually, I'm going to erase this because we already said it's concussion. So this is going to be my grade 2. In a grade 2 concussion now, here the symptoms were less than 15 minutes. Now the symptoms are going to be greater than 15 minutes. So my symptoms are greater than 15 minutes. Okay? Also though, in this one, there's also no loss of consciousness. Okay? This person's going to miss more playing time than the person who would be right here. All right? And then the third type, there's going to be, this is a severe concussion. That's a grade 3. All right? It's a grade 3. And in this here, you have a loss of consciousness. The person knocked out. Okay? So one of the things that you need to look at is if you think of a boxer, and when you have people boxing, when we're talking about football players like going head to head, which I don't think they allow anymore, when you look at boxers, you got someone punching. What they're actually doing there is they're actually causing the skull to go back into the brain. Either way, it's going to cause a lot of damage, whether you're a football player or you are a boxer. So there's our 3 different types. This person here is going to miss a lot more time than this person who's going to miss some time here also. So some more things about concussions. Unfortunately, one of the things about concussions is once you've had a concussion, they're more likely to get more. Okay, so they got to be extra careful here. All right. The other thing about concussions is repeat concussions can actually cause long-term disability or can even cause death. It's a condition we call chronic traumatic encephalopathy, also known as CTE. So repeated concussions can cause disability, long-term disability, or death, or both. Okay? And this is called chronic traumatic. This means trauma's involved, right? Because of all the blows to the head they've had. Encephalopathy. Okay, cephala means brain. And in this case, pathy means there's a disease or there's something wrong, medically wrong with the going on. So here we have something's going wrong with the brain. Okay, and again, it's not uncommon to find people who have had these problems will actually have the long-term disability, will actually have the chronic traumatic encephalopathy. This is why, if you notice, sports are now trying to avoid having people play who have had concussions. They've done a good job of cutting down on these. One last thing that people have heard is that if you have a concussion, don't go to sleep. This is not medical advice. If you have a concussion, you need to see your doctor. Or if you think you have a concussion, you need to go to your doctor. But for the most part, it's usually okay to go to sleep after 4 hours. The reason they say that you may not want to go to sleep is because if I've damaged my brain and I'm bleeding and I don't know it and I go to sleep, I can actually slip into a coma and a person may even pass away, or at least stay in a coma for an extended period of time. Whereas if they're awake, you could have gone and taken them to the hospital. So for the most part, the protocol is usually it's okay to go to sleep after 4 hours. This is not medical advice again. If you have trauma to the head and you think you may have a concussion, you need to see your doctor. I hope you enjoyed this video, and thank you for watching.